to go. Med Demo Part 2. It is February 7th, 2021 at 16:35. So we're going to go ahead with our first check. We have Jake Nursing, Finis 312-654-987, 312-654-987. Date of birth, January 1st, 1960, January 1st, 1960. Dr. Skills Lab. This patient has known allergies. So we're going to compare our meds now. So we have ondansetron, right drug, 6 milligrams, right dose, intramuscular, right route. Should be given daily before supper. It is due at 1700. It is now 16:35, so we will be administering this medication. And then we have heparin, but that has been signed for today already. It was due at 0800, so we won't be giving that one right now either. This has been signed by 2 transcribers, and I see over here it has been signed by 2 transcribers as well. So we're okay to proceed with prepping the medication. So performing hand hygiene. I want to select my medication. So here I have ondansetron. For 6 milligrams, so this is 2 milligrams per milliliter, so I'm going to need 3 milliliters of this medication. It is for IM administration. There is no indication on here that it is for intramuscular, so we're going to have to check the drug monograph, but just checking that there is that this medication is not expired. It is not expired, we're okay. So moving on to our monograph here. I've got ondansetron. It may be administered by a student nurse. The max single dose is 8 milligrams for a patient of our age, and we're only giving 6, so that is okay. It is okay for IM or subcutaneous route, administer undiluted, so I will not be diluting this medication. We are good to go with prepping, so I'm performing hand hygiene again. I'm selecting a 3 milliliter syringe because that's how much medication we need to draw up. I need a blunt film needle. And then for this IM injection, I'm selecting a 23 gauge 1-inch needle. That's appropriate for an intramuscular injection. So I'm going to go ahead and begin prepping. We're cleansing the top of the vial for 30 seconds to ensure that it is clean, but for demo purposes, we're not going to do the full 30 seconds. So while that's air drying, I'm going to open my syringe and open my blunt fill, attach those to the lure lock, and I'm going to withdraw 3 milliliters of air. So the top of the vial is dry now, so I'm going to inject the 3 milliliters of air. Flip. Okay, and as you can see, this vial is dripping, but that is just because that it has been used so much. In real life, this would not be happening. So it is basically pulling itself out at this point. I'm going to withdraw a little bit more than 3 milliliters because we can see that there's a couple bubbles in there. Pulling out using that scoop method. Close in on that. So I'm going to pull back all of the medication from the blunt fill and knock out any bubbles that I see. That's just a dot. Cool. So removing the blunt fill and putting it in the sharps container. I'm now going to attach my 23 gauge 1-inch injection needle. Okay, and now I'm going to calibrate the correct dose. So pushing this up, I can see that I'm going to need to waste. So I'm going to uncap this, ensuring that I'm not getting any medication on the injection needle because that might cause some local skin irritation. I'm just going to waste a couple drops of this medication so that I can get the correct volume. Again, using the scoop method. So as you can see here, we have 3 milliliters, no bubbles. And now I can prep the medication label. So we have Jake Nursing, ondansetron. The dose is 6 milligrams. The volume is 3 milliliters. Concentration is 2 milligrams per milliliter. The date and time is February 7th, 2021 at 16:35. This is by KSUMSN2. I'm going to show you my med label. There it is. Okay. So I'm going to move into my second check now. So I have Jake nursing, ondansetron, 6 milligrams. Here it says 2 milligrams per milliliter, so I have 3 milliliters. And just checking to make sure that I have 3 milliliters again. It is to be given intramuscularly. I've checked the drug monograph to ensure that I can give this medication intramuscularly, and I can. So I have selected the 1-inch 23 gauge needle, which is appropriate for IM. It is to be given daily before supper. It is due at 1700. It is now 16:35 and not signed for today. So I will be proceeding with giving this medication. The vial is now in medical waste. So prepping to go to the bedside. I have my syringe, my label. I need a pair of gloves, alcohol swab, and a cotton ball. I'm bringing my drug information, MAR, and a pen. So going into the patient's room. As I'm entering, I'm doing an environmental safety check. So the environment is clean and clear of any hazards. As I'm coming in, performing hand hygiene. Introduce myself. My name is Kaylee. I'm going to be a student nurse today. I'm here to give you your medication. So I'm just going to ensure that I have the correct patients. Can you tell me your name and your birthday? Okay, I'm just going to confirm. Jake nursing, January 1st, 1960, January 1st, 1960. And do you have any allergies? No? Okay, good. That's what we have written down here. So now I'm going to move into doing my third check. So with my needle and my label, my MAR, we have Jake nursing. I've confirmed that this is Jake nursing. Ondansetron, 6 milligrams. I need 3 milliliters, and I still have 3 milliliters here. It is to be given intramuscularly. I have an intramuscular appropriate needle. To be given daily before supper at 1700 is now 16:35, and it is not signed for yet, so I'm able to give this medication. So a little bit of patient education. So ondansetron is an antiemetic. That is what you're getting today. It is used for the prevention of nausea, vomiting associated with chemotherapy or radiation therapy. So that is going to relieve that. So side effects might be dizziness, drowsiness, weakness, or abdominal pain. So if you feel any of this, please let me know. Ring the call bell and I will come here to assess you. I've assessed this patient's history of hypersensitivity. They have no known allergies, so we're okay with advancing to giving this medication. I have assessed the patient's vital sign and done a GI assessment, and there's nothing that contradicts getting this medication. But if you do experience any dizziness, just use caution when you're moving quickly or walking, because we don't want you to have any falls. So we're going to go ahead and perform hand hygiene and putting on our gloves. So since this is such a large volume of medication, I've chosen the vastus lateralis route. This muscle is large enough to hold up to 3 milliliters of medication, and that's how much we have. So for vastus lateralis, for landmarking, you're putting one hand on the greater truncator, one hand above the knee, and it is this middle third portion here on the anterior lateral perspective of the leg. So this is where I will be giving this medication. So here we are cleansing the site for 30 seconds, but for dynamo purposes, it is not going to be the full 30 seconds. Getting my cotton ball ready. Opening bat. So we're Z-tracking, inserting at a 90-degree angle, and the stabilize. And then we are injecting the medication. slowly into the muscle tissue. I have ensured that my locations policy does not require me to aspirate before I inject. Release the Z-track. I would activate the safety mechanism on this needle in real life, but for demo purposes, I'm just going to put it into the sharps container. We're putting a cotton ball over that injection site, but we're not massaging, just to make sure that we're stopping any bleeding that might occur, because we did go into the muscle tissues there. So that's done. Removing my gloves. Hand hygiene. I'm going to sign for the medication. 2. So we got KSUMSN2 there. Oops. Is it good? Okay. So that's supposed to be in the garbage. Mr. Nursing, I will be back in about 30 minutes to assess your nausea and vomiting and make sure that has gone away. But if you experience any of the side effects I mentioned, please ring the call bell and let me know immediately, and I will come there to assess you. But with that being said, I am all done. I'm performing my exit safety check. So patient's not in distress. Call bell is within reach. The bed is at the lowest height. The environment is clean and clear of any hazards. And so I'm leaving the patient's room. Done.